There's not a lot that we can't help people with. Even if we need to give them a referral, we can, if they need a specialist, we can help set up a referral for them to see a specialist if there's something that we can't do here. We have a huge lab here on site. We do blood work of all sorts, plus all the rapid tests. So if you come in with anything that's suspicious for flu, we're going to do a flu test. We have partially funded through student service fees, and then partially funded with insurance billing. We bill insurance, and whatever the insurance pays us, we will take that as the payment.
Okay.
Their student service fees that you've already paid will cover any copay or deductible that you have. And so you will actually get credit on your insurance for paying a deductible, which is actually to your benefit, because a lot of people you may have to pay like $150 deductible before it starts paying anything. Well, you'll get credit of paying that deductible when you come here, and we've used your student service fees to pay for that. Now, if you don't have insurance, your student service fees cover all of it. So when you come here to see the doctor, you are not going to have to pay anything, whether you have insurance or not. Complaints aren't that uncommon. We get a few every year. Not a huge amount, but yeah, we do get a few. A lot of students come in the very morning they woke up with a sore throat, and they may not have very minimal symptoms. And at that point, it may not look like very much of an illness. And so we always try to tell people, at this point, looks like you have a cold, try these medications. If you're not getting better, come back. Not uncommonly then, a week later, they're getting worse instead of better. Or several days later, they're getting worse instead of better. And instead of coming back to see us, they'll go to see someone else. And they'll go see someone else, and they said, I had an ear infection now. So they'll call us and say, hey, you misdiagnosed me. I had an ear infection. Well, if you would have come back and seen us, we would have seen the ear infection. It was just too early to see it at that point. And that's true with any doctor's office. I'm sure you heard in the past, this used to be called the quack shack. Doctors who didn't know what they were doing were called quacks. And the best way to combat that is by providing good medical care and just letting the word get out. And I think over the past few years, it really have made a stride toward that. The providers we have now are all licensed. We have 3 licensed physicians and 1 nurse practitioner. And they all do a really good job. We worked really hard at trying to update our patient education handouts to try to help not just treat, but to let students also know what they can do to try to help take care of themselves. It's a lot more explaining what's going on, as well as trying to be aware of things that are especially common in this age group too, and making sure we don't miss something important. There's a lot of students that don't know we're here at all. They don't know we exist, or if they do, they don't think about us when they get sick. But really, we can get people in and out fairly quickly, especially if you're trying to compare something to like an urgent doc or the emergency room or something like that.